Alexnder Technique is a specialized form of therapy which can be utilized to treat a cervical herniated disc. I had the opportunity to speak with Judy Stern, who is one of the world's leading experts on Alexnder Technique. She's a teacher who travels all over and has a practice in Rye, New York. Let's hear what she has to say about Alexnder Technique for the treatment of cervical herniated disc disease.
So hi, I'm Judy Stern, and I'm a teacher of the Alexnder Technique, but I'm also a physical therapist. So I have a double skill. And for the first 18 years of my life, I worked as a physical therapist, seeing people with herniated discs in their neck and many other things as well. And then I learned about the Alexnder Technique from a cousin who had a herniated disc.
In the neck?
No, it was a low back.
Low back, okay.
And I was completely fascinated by the idea that I could work less hard, I could teach someone to get well and then to stay well. And that I could do that in a much more holistic way than treating a neck or a low back or an elbow. And the Alexnder Technique for sure is an approach to health and well-being for the whole system.
Right.
And assuming that if you take the compression out of a system that doesn't like compression and that actually gets injured with compression, that if you could remove the compression that comes with tension and stress, that oftentimes the structures that are being compressed and creating problems, even a radiculopathy, can be alleviated.
Is Alexnder, is it an exercise? Is it a something
That's
to
a
talk
great
about?
question.
Like, what is it? Yeah.
So I am very fond of saying that the Alexnder Technique is the how-to of how to do everything.
Okay.
So an Alexnder lesson consists of two parts. One is a practical part where I work with you in how to sit, stand, bend, walk, play the violin, be at the computer. And the other part is a lesson that happens on a table that looks a little bit like a massage table,
Okay.
where I teach you in a more passive way how to think and create ease in your system.
So it sounds like this is a one-on-one type of therapy. Is that right?
In general, especially for someone with a herniated disc,
Right.
one-on-one is absolutely the way to go, because
Okay.
what I will do in a lesson is give you an experience of your kinesthetic self that's different from what you are now. And the hands-on part of that lesson is really what makes the difference.
Yeah, I know I've heard wonderful things about Alexnder Technique for people with all sorts of pains, and I refer patients to you and have for years.
It's true.
How long have we known each other, Judy?
Oh my God, it's had 25 years?
25 years. So,
Yeah.
and you do miracles for patients, and I tell people you're a true healer. But when I have a patient with a herniated disc, with pressure on the nerve, there's pain going down the arm, numbness, tingling, I really don't know. What could you do to help that? Like, how would you even approach that?
So my approach to that is, first of all, if somebody has hard neurological signs and excruciating pain,
Right.
I would never see them myself. I would send them immediately to be evaluated before I would try the Alexnder Technique with them.
Okay.
So that's sort of a rule of thumb for me.
So who's your perfect patient?
So my perfect patient is someone with soft signs.
Okay.
Someone who may has something that someone calls a bulging disc,
Right.
or may have a mild herniation, has symptoms that are on and off. That tells me there's some real chance that if the symptoms go off and on, that I could teach them how to keep them off. So with someone who's in extremis, it's like somebody having a heart attack. You don't put your hands on them. You call EMS.
Perfect. So just to clarify, to help people out there, if you have a severe pain, numbness, tingling, weakness down the arm, big herniated disc, probably Alexnder would not be your first step.
You need a neurological evaluation.
Okay.
Right. No, and I wouldn't want someone to come here for that.
Okay.
Right. But what I like is the patient with the herniated disc where it's indecisive, where you're
Okay.
not sure whether surgery is indicated, where you are looking for a conservative trial to see if we can alleviate the pressure on the spine and let that disc reabsorb.
Okay.
Or actually move back to where it belongs, to take the downward pressure away.
Great. And how do we find an Alexnder teacher?
It's a great
You're
question.
here where we are, but for someone out watching the video in Oklahoma, what do they do?
So
how do they start?
there is a national website.
Okay.
It's called AMSAT, A-M-S-A-T, the American Society for Teachers of the Alexnder Technique.
Okay.
And there is a directory it's by state and area, usually probably by zip code. And if you're looking for a teacher in your area, you can go to that website and you can find a teacher.
So the bottom line, I love Alexnder Technique, but I'm not sure it's for everybody with a cervical herniated disc. What you learn with Alexnder is really great and will help you with every part of your life. It's certainly worth a try if you have a cervical herniated disc. Within a week or two of lessons, you'll know whether it's for you. And if you're getting better, by all means, continue with it. If not, then you'll have to move on to more aggressive treatments. But I think the lessons that you'll learn from your Alexnder teacher will help you with body mechanics, how you sit, how you stand, forever.